My best here. 15. Okay, thank you. Thank you, Jeff. So this morning, we've started out by making a pretty unequivocal case for the relationship between education and health. And now that we know that, I'm going to focus on the opposite connection between health and educational attainment. And I think that provides a great opportunity for how the sectors can work together in tangible ways. So no matter what we do to improve schools, no matter how effectively teachers can teach, how rigorous curricular may be, what assessments or standards are put in place, how we organize schools, the educational benefits of all these efforts are going to be limited unless the students are motivated and able to learn. And something that has been referred to as health barriers to learning has powerful, but up till now has had really been largely overlooked as a determinant, as a strategy to promote academic achievement. One of the things we've talked about a little this morning are these reciprocal causal relationships between education, health, and poverty. And I think one of the important points is that throughout America, when you look at the population segment that's most dramatically affected by all three of these problems, we're really talking about the same population of kids in a dramatic way. So 40% of the high school dropouts in America come from really 10% of the nation's schools. And you can go to cities throughout America or in rural America, and we're talking about the same population segment. I'm going to focus on health factors that affect educational outcomes and then what we can do about it. So schools can't do everything. They have to have a way to prioritize. Up till now, they haven't really been engaged in this health agenda. It's never been part of the fundamental missions, yet schools are one of the most powerful social institutions in our society, along with economic policy, media, healthcare, family, to influence and shape the lives of youth and shape the lives of our nation. We have to have criteria for prioritizing, and I suggest considering the extent of disparities, evidence of causal effects of health factors on education, and evidence that we can do something about these problems. So based on those criteria, I'm saying that these are a set of health problems: vision, asthma, teen pregnancy, aggression and violence, physical activity, skipping breakfast, and ADHD that warrant consideration. It would be a mistake to get caught up in a debate about what is or isn't on this list. We can really, mental and emotional health needs to be thematically addressed because it's a cause or a consequence of every one of these. We can talk about dental and oral health problems. We can talk about substance abuse. The idea is that there are multiple health problems that collectively influence academic achievement. All of these problems are highly prevalent and disproportionately affect low-income kids. And I'm not going to really dwell on this because it's not controversial. And sadly, these prevalence estimates and these disparities have existed for many years and persist today. Vision problems affect, low-income kids much more than higher-income kids. Here you can see the prevalence of asthma. You see, compared with whites, blacks have asthma prevalence about 45% higher. The last two bars show the importance of disaggregating the Latino population. The important thing isn't the prevalence of asthma, it's really poorly controlled asthma. And these same disparities exist, which is evidenced by overuse of emergency rooms for rescue and underuse of efficacious medications that we know can control asthma symptomology. These data are a little old. Shows that compared with whites, female African-American teens are 3 times more likely, and Hispanic teens are 4 times more likely to have a teen birth. And this gap is really closed a lot. Nevertheless, these groups are still twice as likely. And again, I'm not going to dwell on this. 35% of high school students report being in a physical fight for the last year. By the way, these are YRBS data based on probability samples of American high school students. Here we show that almost 1 out of 10, almost 10% of Hispanic high school students in America say they've missed 1 or more days of school in the last month because they were afraid to be at school or to travel to or from school. Breakfast, we don't really have great data on breakfast consumption. The data that we do have suggests that many youth do skip breakfast and there are disparities. While the relative, absolute gap declines from age 9 to 19, actually the relative gap between black and white girls increases. And ADHD is really an overlooked, understudied problem that has dramatic effects. And Janet Curry has shown that while the diagnosis of ADHD is pervasively important, actually subclinical symptomology also has very powerful effects on learning. So, as I said, this is really old news, but the next topic is relatively new. It's based on research in about the last 10 to 15 years, and that is how and why do these health problems affect academic achievement and educational attainment. And there are at least these 5 causal pathways. So cognition pertains to working memory, ability to focus and sustain attention, shift from one task to another, solve problems, think critically. Sensory perception, just seeing well, hearing well. In New York City, in the 60 lowest performing elementary schools, vision screening in kindergarten shows 25% of them fail the vision screen. The bad news is when you rescreen those kids in first grade, 60% of those, or 15% overall, fail again, indicating they never get the care they need for their eyes. Imagine trying to learn how to read when you have hyperopia, as most of us do now. And you're trying to distinguish and decode letters and words. Very, very difficult when you can see well. This third criteria, school connectedness and engagements, are a very important factor. It has to do with the extent to which the young people in school feel like they belong there, whether it's a place they want to be, whether they feel like their peers and others care for them as people, as about learners. It's about human relationships, and we know how important human relationships are in shaping our mental and emotional health, and indeed that in turn confers benefits and opportunities for learning. Absenteeism is also a very important factor. We know that about 20% of the 1.1 plus million public school students in New York City schools are chronically absent. That means they miss a month or more of school each year. That's staggering. And we also know that chronic absenteeism in the early grades is highly predictive of high school graduation, and of course temporarily or permanently dropping out confers lifelong effects. So these next slides talk about the different health problems and how they're causally related to the causal pathways. And I don't have time to go through this in great detail. I'm going to just illustrate on one set of these. But the important thing that I'd like you to notice is how for each one of these causal pathways, it's influenced by multiple health problems simultaneously. So vision problems here, we're talking not so much about sensory perception or refractive error, we're talking about visual motor integration, the connections between our eyes and our brain. How does asthma affect cognition? Because poorly controlled asthma results in sleep deprivation. Having 6 children, I know a little about sleep deprivation. It really interferes with your ability to concentrate, with your ability to stay focused on tasks and really succeed. And children with poorly controlled asthma not only are absent late more to school, but when they attend school, if they've been sleep deprived at night, it's much harder for them to succeed and learn. We know that aggression and violence dramatically affects our ability to think. You see this from the ACEs study. You see this from Jack Shonkoff's work showing how early exposures to aggression and violence actually affects our genetic predispositions and neural circuits in our brain and has implications for working memory and other aspects of essential for learning. Thousands of years ago, the Greeks knew about the connections between our physical health, our physical activity, and our minds, but it's only really the last 10 to 15 years that molecular biologists and neuroscientists have shown how and why physical activity affects things like our working memory and the uptake of neuronal factors and our brain plasticity. School administrators know that breakfast is important. They always send a note home before the test to make sure that children eat a good breakfast on that day before the test. It's probably a really good idea in those other 179 days of school when the kids are trying to learn things. And by definition, inattention and hyperactivity, by definition of the criteria for diagnosis, it really affects thinking ability. You know, the ability to concentrate and pay attention is a high-level skill. And as I said, I don't have time to talk about the other pathways, but each one of these other pathways is affected by multiple problems simultaneously, which is antithetical to the way that we study these problems. And Steve alluded to this, and I'm going to come back to it because I think it's very important. But you can see for absenteeism, and the evidence is there for every one of the causal links between the individual health problems and the causal pathway of interest. So what's the academic imperative? If a child can't see well, they can't distinguish between a P and a B and a D and a Q, it's obviously going to be much more difficult when they're in kindergarten or first grade to acquire basic literacy skills. If a child is sleep deprived because they've been up coughing all night, as in some cases, very large percentages of kids in the South Bronx or in Detroit or in pick the city throughout America, and you'll see very high prevalence rates of poorly controlled asthma. It's going to be much harder for them to really pay attention and be focused in school. If you're not in school because you become pregnant in a young age, we know that that has dramatic effects on your ability to graduate from high school, and that's been really shown repeatedly, and that's even once you adjust for socioeconomic factors. If you attend the school that's characterized by aggression and violence, or there's nasty graffiti written on the walls, it's not going to be a place where you want to be, where you're going to really be likely to be engaged in the learning process. If you're come to school and you're hungry, it's much harder to succeed. And if you can't pay attention, you can't learn. So what are the implications for doing this? Well, before we get on to that, as each one of these factors has powerful effects, we have to recognize that many of the children living in poverty are affected by multiple problems simultaneously. And these health problems not only have additive effects, they have interactive and synergistic effects. You can see this from, for example, the consumption of breakfast and physical activity and sleep on cognition. It's been shown quite persuasively. The implication is that intervention programs must therefore focus on multiple problems simultaneously. Unfortunately, that's not the way most of our evaluation research has been conducted. And you can look at the hundreds, if not thousands, of studies showing that when you look at breakfast alone, it doesn't have large or consistent effects on achievement. If you look at physical activity alone, while there are demonstrable effects, the effects tend not to be large or consistent. And you can go down the list. So we have a research paradigm where we're concentrating on the engine of the plane rather than on the system, and it's not serving us very well. So that's a problem. So how can schools influence the health of youth? Well, we actually know a lot about how to do this, and as in many other instances in behavioral social sciences, so am I out of time? No, I don't know. Yeah, pretty much. I'll try to wrap it up quickly. We have to have a strategic focus on health problems that we know have powerful effects on education. We have to rely on evidence-based programs, and I really like the term evidence-based, really scientifically generated knowledge rather than evidence-based programs, because we're not doing that well at implementing the same program in lots of different contexts. And we have to have efforts that are effectively coordinated. And as Steve pointed out, we do play in these silos. And worse than that, we not only have these silos between the sectors, but we have the silos within the silos. So that's really not serving our children very well at all. So in the last minute or two, I'll just say, you know, policy mandates and accountability are going to be challenging because unlike most other countries in the world, the United States has a completely decentralized educational system. That said, I think the United States Department of Education can really have a powerful role to play because they can influence state education departments through a variety of ways. There's a dramatic need for communication about these links, as Steve pointed out, and to engage families in the process. And effective programs really have to be 2 or really 3 generation types of programs where you're focusing on children, adolescents, and caregivers. There's a need for financial support and incentives and technical assistance and professional development for teachers and school leaders that don't really learn about this in their professional preparation programs. There's a dramatic need for interagency collaboration and public-private partnerships and data systems and research. Well, one of the marks of good research is a good research program will always raise more questions. But right now, we actually know a lot about what to do. The problem is we're not doing what we already know. We have to put into practice things that we've already learned through lots of investments in research and development. We know about health programs that will improve academic achievement. The problem is that in the past, many of the most widely implemented school health programs have been programs with no evidence of effectiveness. And that is never tolerable, and it's certainly not tenable today. Colleges of education, colleges of medicine, and public health have an important role to play in preparing the next generation of teachers, school leaders, pediatricians, other practitioners in the community. And right now we have a tremendous problem for the reimbursement of healthcare services in schools. It's not easy to provide healthcare in schools. Medicaid makes it difficult to pay for those services, but schools are a powerful place to have an influence on youth. That's where the 50+ million young people in America go every day. And just in closing, I focused on the school-age population because we have this infrastructure of over 100,000 schools in the United States. It's in no way meant to take away from the important priority of the preschool population. And hopefully now we're going to start to build that infrastructure, which will be dramatically important. So thank you very much.
So thank you, Charles. So now we've heard the data from a health perspective, we've heard the data from an education perspective, and now we're going to hear about how it can come together. So Allison Gertel Rosenberg will lead off with the Nemours presentation, followed by David Nichols.